The topic that was given to me is an approach to fever, a very vast topic. It's like an umbrella, and everything under the umbrella is fever. So, an approach to a patient with fever. This is just a brief on how we go about it. The plan is that we're going to have more discussion, because since you're already practicing, in your respective fields, your vast experience is going to help us together gain more knowledge on the subject, which is a very, I tell you, this is called a physician's nightmare. Very commonly, this is what we've seen our colleagues say, that this is a physician's nightmare. Fever, matlab, please don't refer a case of fever to me, because it's very difficult, because today's fevers are not the same. Theory and practice is very different. Earlier in our practice, we only saw one type of malaria at one time, meaning either it is a vivax or falci. Today you have mixed infections. So, they are very difficult to treat, more aggressive, more fatal. So, fever is a physician's nightmare. With that, let's just begin. What is fever? This is something that we need to know really well. Body temperature is controlled by hypothalamus. So, the central role is the hypothalamus. Hypothalamus, the most important function is thermoregulation. In the shivering and sweating, shivering in case of cold and sweating when it's hot, is both controlled by hypothalamus. So this, I think, has to be understood really well, and therefore fever has a CNS origin. So it is a temperature controlled by hypothalamic thermoregulation. Now there is a WHO definition to fever. What is fever? Fever is defined as elevation of body temperature. Fever or pyrexia is defined as elevation of body temperature that exceeds the normal daily variation. Normally we all have 37 degrees centigrade as our body temperature in terms of degrees centigrade. What exceeds the normal variation with an increase in hypothalamic set point. If your hypothalamic set point is set 1 degree higher in the CNS, you have fever. So I am coming back to the whole thing, that fever is regulated by hypothalamus. Thermoregulation is the most important function of hypothalamus. This is the WHO definition, that fever is regulated by hypothalamus and it is elevation in body temperature, and the set point is controlled by hypothalamus. What is the physiology of fever? The most common physiology is this, that fever increases the oxygen demand in the cells. Oxygen, how do the cells have oxygen? Which is the most important part which has oxygenation in the cell? Mitochondria. Mitochondria is the respiratory organ of a cell. We are aware of an animal cell and a plant cell, right? An animal cell is what is the superior cell as compared to a plant cell, and in that you have mitochondria, Golgi apparatus. This is the oxygenation or the respiration of the cell. So fever increases the demand of oxygen in the cells. For every 1 degree rise over the normal variation, that is normal 37 degrees, there is a 13% increase in oxygen requirement. All these facts and figures are from Harrison's textbook of internal medicine. These are globally accepted facts and figures. 13% increase in oxygen requirement because of fever, just 1 degree rise of temperature. And this is very commonly seen to affect which patients, and affect badly patients who already require more oxygen. For example, people who have a bad lung, they require more oxygen routinely, and therefore fever in such a patient who has a chronic obstructive lung disease, COPD, pulmonary embolism, any lung infection, this is going to be detrimental in such a case. Cerebrovascular accidents, people have stroke, people who require more oxygen at that time, a fever in such a case is a bad prognosis. So fever in a cerebrovascular accident is a bad prognosis. Then of course cardiac, pre-existing cardiac illness, which includes myocardial infarction or valve replacements. So people who have had valve replacements or pacemakers, in them fever is not a good prognosis because it requires more oxygen. Are we clear on this? So fever 1 degree rise requires more amount of oxygen by the cells. what is the regulatory mechanism of fever? One, we understand that in our immune system, there's a lot of immunity connected to fever. If you have good AMI, CMI, you cell mediated, antibody mediated, and innate immunity, which is the NK cells. There are 3 categories of cells. A little deviation from the topic for a minute. There are 3 categories of cells. T cells, B cells, macrophages are the backbone in immunology. T cells primarily associated with CMI, cell mediated immunity. So if you have a good CMI, you can tackle those infections which attack the T cells. Is your innate immunity. The B cells come from bone marrow. You've heard about this earlier, right? B cells, what are they going to do? AMI, antibody mediated immunity. So AMI, which is antibody mediated, is IgG, IgM. IgG antibodies, IgM antibodies, IgA, IgE. Those are antibodies which are playing a role in prevention of infection and allergy, right? The third cell is the null cell, NULL. Null cell has 2 cells, killer cell and natural killer cells. K, killer, NK is natural killer cells. These cells are important to prevent cancers. They are tumoricidal, virucidal, kill the viruses, kill the tumor cells. So these cells are the ones which have innate immune to the body. So there are some people who by their structure or their constitution are very susceptible to infections, because of their immune system, immune apparatus, which is a little haywire from the usual. So endogenous pyrogen, coming back to a little bit of immunology, because immunology and fever goes hand in hand. One, cytokine. Cyto means cell. Cell which regulates immune response, cytokines. They are also known as interleukins. Leukocyte, WBC. Inter means between the 2 WBCs there is communication. Between a neutrophil and a lymphocyte there is a communication. Between a lymphocyte and an eosinophil there is a communication in our body, right? So interleukin 1 is IL-1. IL-1 is a very, very important cytokine. It is known as endogenous pyrogen. Endogenous is in the body itself. Pyrogen means fever. An agent which is going to cause fever is interleukin 1. Very commonly and very interestingly, whether it is a septic shock, whether it is a post-accident syndrome, IL-1 is produced in large amounts, because that will help the bacteria to be killed. So this is an immune system response to prevent fever. Are you getting this? So it is an endogenous pyrogen. Endogenous, produced by the body itself, and an agent which causes fever. Pyrogen. Pyro is fever. So IL-1 is an endogenous pyrogen. It regulates the immune system, immune response. It regulates the immune response to an antigen or a foreign substance. The antigen can be of different types, either inhalation, ingestion or inoculation. Can you hear me now? Is that fine? Can you hear me? Yeah. So cytokines regulate immune response. So they regulate the immune system to an endogen or a pyrogen, which is either